Okay, can you guys see my screen?
Yeah.
Okay. The peer review is not due, the peer review you're not doing until week 7. There's no peer review for this initial one. Okay, so let's go to week 3, case study. Okay, I don't know if anybody's read this, but you'll need to work in groups. You'll be assigned one of the 3. Your group needs to complete the responses by Wednesday. Okay, so here's your instructions. So your paper needs to get submitted by Wednesday, because then it's like treated as a discussion question. Then you'll have from Wednesday to Sunday to do your 2 responses to one of your peers' papers. Does that make sense?
So just to clarify, in our discussion, the only thing we will have is a link to our paper, which people will click on and then respond to our paper.
Yeah, exactly. Exactly. So
Okay,
let's go into discussions, and let's go to right here. Okay. So this is what it will look like. This is what it will look like for me. Okay. So there's all the discussions, and then you reply. So when you reply, you can do an attachment. You know that, right? So you attach your paper in there, and it just is a flowing discussion board. And then you'll be able to, between Thursday and Sunday, click on other groups' papers and make comments on them.
Is there a requirement for how long the paper is?
Nope.
Okay.
Nope, just as long as you address the case study.
All right, thank you.
Yeah, and it should be in a paper format, so your cover page is all U4, and whatever your case study is. I'll figure it out, but just a proper, kind of like you did your cover page for your professional development plans. Okay.
So to be clear, one last question.
Yeah, of course.
That the case study is our discussion pretty much.
Yeah. That's your assignment.
Okay.
Okay. Yep. That's your discussion, and then you'll do your peer responses. Yeah, and this is the first of 2 group activities. The next one you'll do, I'll assign infectious diseases to the group at some point in the next couple of weeks. And then that's the group that you'll do a peer review. And there's a link right to, where are we in week 7? So group project discussion and peer review activity. If you want to read ahead, that's what this is. And here's your peer review submissions. So you click on that link, and it asks you to, the form's right here. It asks you to complete it for your peer group. Okay. And it can just be one. You don't have to do every group member separately, but we'll talk more about that as the term goes on. But the week 7 does include a peer review, kind of an extra step. Okay. I would like to get you to your announcements. I posted a couple things this morning, or last night and this morning. Your exam 1 study guide is posted. Okay. I would highly suggest that you print that out. I've already done a review this morning. Each of you got your review schedule last night, this morning, sorry. And so here are all the reviews. So there's going to be 1, 2, 3, 4, 5. There's going to be 6 reviews for each exam. Each professor is going to do a review. I was first out of the chute this morning and did my exam review at 11 o'clock and really had a good turnout. Had over 20-something students. And so I've already posted the recording for that, and that's in your announcements, but I wanted to draw your attention to this. This is planned out for you for the whole term. Okay, so you need to go and look at all the exam 1 reviews. They're coming up between today and Sunday. Okay, you can attend one, you can attend all of them. Everybody's going to get recordings. So I've already posted my recording and sent my recording to the other 6 instructors, and they'll be doing the same. So as each of these reviews happen, The instructors will send out the recording to all the others, and then I'll be posting them. So you'll have the opportunity to go to either 6 live reviews, and you'll have 6 recordings. Okay, so those have started. Again, I posted, that's your schedule. So we do it for the whole term so you can plan ahead. Okay, and here's my recording from this morning. It's already up there. Your study guide, I would highly suggest that you try and attend one of these live reviews. The study guide is exactly that. It's a study guide. The study guide is full of all the concepts that were covered in the first couple of weeks. As I told my review group this morning, I would encourage you to watch that recording from this morning. It gives you a really good overview of the exam, of, you know, test taking strategies. I go over test taking strategies. I don't go through the study guide word by, line by line. But I would encourage you to print out the study guide, what you're familiar with from your readings and your PowerPoints. That's great. Highlight that. Don't need to dig anymore. But if there are areas in the study guide that you don't understand, you'll need to go back and review your PowerPoints, review your readings, and make sure you can find the answers to those. Okay. If you have a good knowledge base and understanding of the concepts in the study guide, you will do fine on the exam. I promise you. Okay. You don't need, we had, how many chapters? We had 1, 2, 3, 4, 5. We had 9 chapters between weeks 1 and 2. Okay. 9 chapters. You don't have to read every chapter from start to finish. Okay. And that's where I want to jump into my content here, because I want to show you what the expectation is going through the chapters, because you don't have to read every chapter from cover to cover. There's bits of information from each chapter we need to pull out. Okay. So that's all my housekeeping stuff. Does anybody, I'm going to stop and share for a minute. Does anybody have any questions? Bernice went to, not to point Bernice out, but she did. Bernice, is there anybody else here? Hey, Julia, Sherelle, and Wendy, could you turn your cameras on, please? Bernice went to the review this morning. What'd you think?
It was good. It was good. You went over some of the topics that were going to be on there, and you told us how to kind of go about and breaking it down so we can get in on what the topic is about.
Yep. I mean, again, I don't review every line in the study guide, but I do the study guide. Where is it?
But I feel like even with a study guide, because like you were saying,
Oh, Sydney, you were there.
Yeah, like even going over and reviewing it, I mean, yes, it's not spot on, but you were able to say, okay, maybe go look in chapter 3 in this box, and it clearly details and tells you this is what you should be looking for. So I mean, I do feel like it's a good roadmap.
And that's exactly what a study guide is, a roadmap. But we have spent a lot of time on this study guide. We are making sure it represents the information that's on the exam from your readings, from your PowerPoints. And so that's where I would start. That is your roadmap. So you need to break apart that study guide and figure out what you know and what you don't know. And what you don't know, we need to go find. And then, as I told the group this morning, after you guys do an adequate prep for the exam, and that means you do your part, I do my part. After you go to review sessions, after you watch the recordings, after you go through the study guide, after you've done all your due diligence to get ready for the exam, if there is something you still don't understand, a concept you still don't understand, please reach out to me before we take the exam. I can meet next Monday or Tuesday to review anything you still don't understand. I don't want to meet to go over things you understand. I want to meet with you to review things that you might not understand. All right, so I need you to do your due diligence in preparation as well. Okay? Make sense? Okay, so I want to go to at least this is what we should be covering. This is how you should be covering the book. Okay, let me share my screen here. Okay, so this is chapter 1 in the book. We had several chapters to cover. Last week we did 1, 2, 3, 9, and 23. The first 3 chapters are more about what's public health. Okay, what's population health? What's the history of public health? And what does the US and global healthcare look like? So that was a lot of real generic information, but here's how I want you to look at the chapters. Okay. First of all, the PowerPoints that we send you on the weekends are essentially the chapter outline. Okay, the PowerPoints are a outline of what the chapter is. Does that make sense? On the PowerPoint, you're going to find on the second page a set of objectives. Okay, so basically this is your PowerPoint, and this adds PowerPoint adds a little bit of information into each of these topics. But here's the meat of what you need to do. Okay, and this is with every chapter. Okay, we go by objectives. Okay, the objectives in every chapter is what you should be able to come away with. So after reading this chapter, it says the student should be able to. So after reading chapter 1, you should be able to answer these 6 questions. Okay, and so you will have to go into the chapter to find out where the answers, where the information is to be able to understand and answer these questions. Because this is how these objectives guide our study guide, they guide our lecture, and they guide the exam. Okay, so objectives are super important. Okay, and the objectives also hone in on the important information from each chapter that helps you understand the concept of what the chapter is about. Does that make sense? I'm trying to help you organize your studying so that you don't feel like you have to go from, start to finish in every chapter. The other thing in community is there's a lot of new language, a lot of new words, a lot of new key terms that you might not be familiar with. Okay, and you might see them on the study guide and you don't know what they mean. So for example, on the study guide, it asks you, please know the difference between community-based nursing and community-oriented nursing. Okay, so if you don't know what that is, click on the word, and it will take you right here. Okay, so it takes you right to, this comes right from the study guide. Definitions of key nursing areas in the community. So one thing you have to understand is the difference between community-oriented and community-based. And what I told my review class this morning, here's the way I remember it. Okay, you are going to get asked about this on the exam. Okay, the way I remember it is with community-oriented, that's more of a big picture. You're trying to get oriented to the community. All right, so it's a generalized look at what are the community needs. Okay, what are the issues in the community? What are the barriers? What do you need to health surveil? What kind of community is it? Right, what kind of population do you have? What are the health risks? So you're trying to get oriented to the big community. Okay, so that's more, a lot of times community-oriented nursing is synonymous with public health nursing. Okay, where you're looking at the big picture. So community-based, I could call on Sydney or Bernice, but I won't. Community-based, the way I remember it, is you're based in the community. You're already caring for clients in the community. Okay, so it's a specific practice setting where you're already providing care to clients and families. Okay, so the emphasis on community-based is acute and chronic care. Okay, so oriented is the much bigger picture where you're trying to identify what's the community all about? What are the positive and negatives? What needs to be worked on? Community-based, you're in the community. So you're maybe a hospice nurse, you're a home health nurse, you have a client base and you're taking care of that client base. Does that make sense? Okay, so that's one, just trying to pull out. So I don't know how much preparation you guys have done. I don't know how much reading you've done for weeks 1 and 2. Can you answer these questions? Okay, I can tell you that all 6 of these they're in your study guide. You know, what's the mission and the core functions of public health? Okay, what is the specialization of public health? And what are our roles in the community? Right? What does it mean? This is an important one. What's population health? Population health, right here. Let's talk about it. Okay. Population health is looking at the population as a whole. Okay. So in community nursing, our clients are going to be definitely from across the whole lifespan, right? You may be taking care of infants all the way up to the elderly. Okay. You may, our clients may be an individual, a family unit, a subset of the population, say obese, the obese population, diabetic population, students at risk for suicide, a subset, homelessness, teen pregnancy. What are some other populations in the community that you might be working with as a group? What else? Excuse me. And what's in your community? What groups are in your community that community nurses might be working with? Homelessness, substance abuse, what else? Mental health issues. So when you're looking at population health, you're looking at the entire population of the community. You're trying to improve outcomes, improve health. That's the big picture. And then when you talk about population health can also be synonymous with community-oriented nursing, where you're looking at the whole population. Okay, and then you have your community-based. Okay, what else is important here? So describe what's meant by population health. Okay, you're looking at the health of the whole population. What are some barriers? What do you think are some barriers to the practice of community and prevention-oriented nursing? Let's listen. What are some barriers to this? What about cultural differences, diversity of culture? Is that a barrier?
Mm-hmm.
Why?
Yeah.
Why? If you're working
Language.
Language barriers,
Religious beliefs.
religious beliefs,
Transportation barriers.
access to healthcare. Right, if you're working in community nursing, number one, you're going to be working with lots and lots of different cultures, and you're going to have lots and lots of barriers. Okay, so be familiar with these objectives. Let's jump to the objectives in chapter 2, and this is from last week. Okay, again, I don't know how much preparation you've done, but you're going to see these objectives in one way or the other in your study guide and on your exam. So are you able to answer these? Did you guys read about Florence Nightingale, Lillian Ward, Mary Breckinridge? Right, so you'll have to go back and do your best to research where in these, and a lot of times, well, let me take this. A lot of times in these objectives, there are keywords that you can pull out, like Mary Breckinridge was just mentioned. Well, here, pull her up in the keywords. Okay. Same with Lillian Wald down here at the bottom. Okay. Know about frontier nursing services. That's in your study guide. Okay. So one of the primary functions of frontier nursing was vaccinations. Okay, that's right in your study guide. There's not a lot from this chapter in the study guide, but we need to understand US and global healthcare. Okay, again, your chapter outline is your PowerPoint. Okay, so it gives you a nice summary of what's going to be covered in this chapter. Okay, let's look at the objectives. Again, I don't know if you know the answers to these. I don't know what kind of reading or preparation you did. And I know we talked about objectives last week. Did we not? Thought we did. But this is how you attack every chapter. Okay. So a couple of key things that we want to know. This is on your study guide. You need to know what the Affordable Care Act is, page 42. Okay, definitely. This is going to come up a lot this term. What are determinants of health? What does determinants of health mean? What determines your health? Okay, right here. Here are your determinants of health. We got to know this. Okay, what determines the health of you as an individual, the community? Right here. Income, social factors, support networks, education, unemployment. Okay, so these are all examples of what determines the health of an individual, the health of a family, the health of a community, the health of a population. Okay. I'm actually trying to help you prepare for the exam as well, pulling out things that are in the exam. Okay. Population health is there. And we need to know about the U.S. Department of Health and Human Services. Okay, they're pretty much the big agency that we work under, and it has all the, it covers Medicare, Medicaid. It has all these different agencies underneath them. But remembering that Department of Human, HHS, is very much a part of community and public health. Okay. And then I want to go to chapter 9 because this is covered quite extensively in your study guide, which means it's covered pretty good on the exam as well. Okay, and this is evidence-based practice. Okay. And there's a whole section on the study guide about evidence-based practice. What is evidence-based practice? And again, I don't know how well you can answer these objectives. Not sure how much you read about this for last week. What is evidence-based practice? We're all using it where we work. What is it? What is it?
When you use the most up-to-date research and testing.
Exactly. Exactly, evidence-based practice. So whether it's research, clinical journals, clinical trials, you are always wanting to use the most up-to-date and current research or evidence to base your practice on. Right? So think of how far we've come with caring for heart bypass patients. Okay, let's say 20 years ago, they were in the hospital for 10 days. Now they're in the hospital for 2 days. Okay, think about how quickly we discharge patients now from the hospital back to the home. All these best practices have been researched and developed over the last number of years, and now we can put that into our best practice for evidence-based practice. Does that make sense? We're always wanting to think about what is best practice. What is best practice in caring for cardiac patients? What is best practice in caring for pediatric patients? What is best practice caring for stroke patients? Okay. And best practice is always, best practice uses evidence-based practice to make it better. Does that make sense? That's kind of the long way of explaining it. But evidence-based practice is critical to our nursing profession. Okay, so you need to be able to define it. What would be some barriers to evidence-based practice? Think of your own attitudes and beliefs. I asked the group this morning, does anybody work with anybody that says, oh, we've been doing it this way for 30 years. It's fine. Don't worry about it. We're okay. Does anybody work with people like that?
Yeah.
Okay. Those are the people that, pardon me?
They don't want to evolve. They just want to
Right.
stay.
Right. And so they're clearly not thinking evidence-based practice, right? Where we as a profession move forward. I mean, that's medicine in general, nursing in general moves forward and is always improving based on evidence-based practice. Right? And my example I said a few minutes ago is just think about the length of hospitalizations now. Right? Through evidence and clinical trials and research, we're able to improve our practice in many, many, many areas. This is called evidence-based practice. So there are barriers to evidence-based practice, and that's described in your study guide. First, you have to evaluate your own set of beliefs and practices and make sure that you're on board with providing the most up-to-date, recent care based on the research. That's basically what evidence-based practice is. Okay. I do want to go through this. What are some types of evidence? You have to be able to determine what are the kind of top to bottom, which evidence is most likely. There's a hierarchy of evidence, right? So the RCTs, the control trials, those are generally the best evidence that we could use. Does that make sense? So randomized controlled trials are number one. All right, that's the best. Then you have your list going down. Okay, and it goes all the way down to expert opinion. If you don't have any of these, then you rely on expert opinion. Okay, but there are types of evidence-based practice that are higher in reliability. Okay, and so what I want you to know is that the random control is the most reliable. These are all they're placed in order of reliability. Okay. and that's part of your objectives as well. Then we get to, let's see, 23. And again, just please take a look at these objectives. That's what we need. That's what I need you to understand. Okay, really important chapter 23. Health equity in the care of vulnerable populations. You're going to hear about vulnerable populations the entire term, because in the community, that's who we take care of. All right, so again, your chapter outline is your PowerPoint with a little bit of information, but let's check out the objectives. Okay, we need to be able to answer these. Okay, describe health equity and its importance to nurses. Population health in its application to nursing practice. Define the term vulnerable population. Describe groups. Describe individual social factors that contribute to the vulnerability of populations. Okay. So again, I can tell you the key words that are going to be important to know from this chapter that are going to be covered in the study guide in the exam are cumulative risks, determinants of health, definitely health disparities. Okay. Health disparities are differences that exist among specific populations. Really important right here. Okay. Health disparities, because health disparities are very prevalent with our vulnerable populations. There are differences that exist among specific population groups that prevent them from attaining their full health potential. Okay. They exist in many, many dimensions, including race, ethnicity, gender, sexual orientation, disability status, socioeconomic status, and location. So that's real important right there. Okay. What else do we need to know? Determinants of health, health equity is another important topic you need to know about. What is health equity? And here's a good definition of our population health that we've already gone through, but here's another good definition of it. And then what is poverty? Resilience. Okay. The one thing to know about this class we'll be talking about is the one factor that influences everything in communities, whether it's individuals, families, communities, is the financial stability. Okay. If you live below the poverty line, you are going to face certain challenges that others may not. Okay. So if you're asked the question, what is the most significant factor that contributes to the health of an individual, a family, a community? Okay. The simple answer is the financial stability. Because if you think about it, if you're living in poverty, everything's affected, right? Your health, your access to health, your education, your maybe food security. Does that make sense? So that's really important. That's an ongoing theme throughout the term. Okay, and I only mention that because it's a driving factor, that the financial stability of one's own personal finances or community, the financial stability of the community has a direct effect on how everything works. Okay. So what are social determinants of health? Okay. We went through this a little bit in a previous chapter, but here are the 7 of them. Income and social status. Okay. Education, physical environment, social support networks, genetics, These are the social, and remember, determinants is a fancy word for what determines your health. Okay. So again, in answering these objectives, that's where you have to go in the chapter. So if the objective has a term in there that's important, pull out the term in your key terms and see it and get some more understanding that way. And then vulnerability, vulnerable populations, obviously that's incredibly important. So part of what you're going to do in week 9 is you're going to do your vulnerable populations assignment, which is worth 8% of your grade. So I just quickly introduce it, but you're going to be picking a vulnerable population in your own community, in your own zip code. Okay. Homelessness, teen pregnancy, mental health, elderly, give a whole list. If you want to look in module 9, it's in there. That's when it's due. So your directions are in there. But you're going to be asked to pick a vulnerable population in your zip code and do a research paper. Okay. So, and by that point, we'll have talked about a lot of vulnerable populations. And so hopefully you have a better understanding, but you all know now in your own communities, you could probably already list out 5 vulnerable populations that you know right off the bat are in your community, correct? I know I can. Then let's see, let's go to chapter 20. Okay, so this is week 2 information. Okay, so again, here's your outline, which that's what your PowerPoint is. Okay, here's our objectives. I don't know how much preparation you did for this week. I have no idea if you reviewed the PowerPoints or reviewed the reading, but how close are you to being able to articulate the answers to this? Explain the multiple ways public health nurses work with families and communities. Identify challenges to working with families and communities. Right? Describe family function and structure. Describe family trends and demographic changes that affect the health of families. And then work with families using a strength-based approach to assess, develop, and evaluate. Remember, this is where I can throw in ADPI again. ADPI is done. We practice the nursing process, ADPI, in the community setting, public health setting. You just have to be able to apply it to this setting. Okay, ADPI looks different in the hospital than it does in the community. The way you assess a individual in the hospital may look way different than the way you assess them in the community. Right? So you have to be able to take your ADPI and think of it in the community setting. I want a family structure. Okay. There are 5 family functions that all families are made up of. They all look different in different families, but I want to introduce this to you because this is on your study guide. Actually, on your study guide, it says know what family functions and structures are. So if you didn't know that, you'd be coming right back here to find this. Okay, there's 5 family functions that make up each family: economic, reproductive, socialization, affective, and healthcare function. It tells you what each of these are. So knowledge of family functions and structures is essential for understanding how families influence health, illness, and well-being. Right? So family functions are the ways in which families meet the needs of each family member, the family as a whole, their relationship to the community. Okay. So you have family functions and structures. Okay. The difference, there's a specific definition for family structure. Okay. So here's your 5 family functions, but there's a definition of family structure. Family structure is basically the makeup of the family. Okay, what are the roles of each family member? I'm the mom, you're the dad, you're the kid, you're the dog, you're the grandmother. That's the structure. But in addition, then that family has 5 different functions that make them up. Every one of these looks different in every family, but those are the 5 basic functions. So in your study guide, when you get to the section that says, know what family functions and structures are, that's all it says. And you don't know that, you'll be coming back to page 342. So I'm just trying to help you out here. Okay. Describe family demographic trends, demographic changes that affect the health of the families. Working with families to use strength-based approach to assess, develop, and evaluate. So again, go into the chapter and be able to answer these questions. Okay. I want to keep moving here because I do want to do that Kahoot that brings in all the content. This 21 and 22 are super important chapters. Okay, this is covered heavily on the study guide, right? Because think about it. What do we do in community health? We're working with families all the time. We have to have an excellent knowledge base of how to assess health risks. And again, here's the other thing, if you're on your study guide and it says, how do you identify a health risk? How do you do a health risk appraisal? You just click right on that part of the outline and it takes you right to it. Does that make sense? So not only do the key terms populate into the chapter, but if there's something on the study guide that says, how do you contract with families, or what is the process of contracting the families look like? There it is. Okay. And again, you don't have to read the chapter from start to finish. You need to read the parts of the chapter that address these objectives. So this is health risks. So here's what we need to know. Determine major risks to family health, identify the interrelationships among individual health, family health, population health, community health. Okay. And a lot of these topics up here in the chapter outline are part of your objectives. So between these 3 sections, your outline, your objectives, and your key terms, you should be able to navigate very quickly to get the answers to the objectives. Does that make sense? Yes, no, too much?
Yeah, that makes sense.
I'm just trying to make it simple for you. I don't want you reading chapter to chapter, chapter to chapter, start to finish. Okay? This is an excellent updated edition 6 to this foundations book. Excellent that you can click right on anything in the chapter outline and any key term, and it will get you where you want to be to get these answered. Okay. And then let's see, that was chapter 20. No, that was chapter 21. And then chapter 22 is very heavily covered in the study guide, which means there's going to be quite a bit about this on the exam. All right. So we're dealing with all across the lifespan when we talk about community health. Okay. Health risks across. So look at how nice this chapter outline. Children's health and major public issues, obesity, injuries and accidents. You're going to see all this in your study guide. Okay, so you can go right back here and pull up this. All right, what are some target areas of prevention with children? Smoking, nutrition, immunizations. Okay, what are some major health and chronic disease, major health issues and chronic disease management of adults? Chronic disease, women's health concerns, men's health concerns. What are some health disparities among specific age groups? Adults of color, incarcerated adults, LGBT, mental illness, elderly. Okay. So again, you have your discussion, major health problems of children and adolescents. Okay, well, let's go back up here. Children's health, major public health issues, right? So there's your answer to discuss major health issues and here you go. Obesity, children's health and major obesity. Remember too, as you're going through the book, when you have like your big header, this whole section is children's health and major public health issues. Remember that all the boxes within this section go in this section. What I mean is they talk about obesity. So here, table 22.1 gives you your BMIs. Okay, that's part of that section. Okay, dietary. Okay, so this is all about obesity. Okay, your next section is injury and accidents. Okay, then it gives you some box information about what are the leading causes of unintentional injury. Okay, then your next section, you're still on injury. Okay, your next section is alterations of behavior and mental health problems. Okay, so the boxes and the, I don't know, the tables, the boxes, just check those out. If they're in a section that you're reading, because that's part of the objectives, that's part of your objective, and one of those boxes or tables pulls up, look at it. Describe nursing measures to promote child and adolescent health. Okay. Discuss risk factors for adults, including men and women. Well, up here, there are major issues for men and women. They're right here. Okay. So let's see. I want to go through school nurse, the last chapter of school nurse. Your study guide is broken out. I'm going to show you. Hang on, let me get through this and then I'll show you. School nurse. That's your last chapter for this week. Let's see what the objectives are. Okay. Let's see, frameworks. Discuss common health problems of children, assess nursing, caregiving in schools, the context of primary, secondary, and tertiary. So I would read your objectives and then go up here and see levels of prevention applied to school. Right here, primary, secondary, tertiary. That is your 5th objective. Identify future trends in nursing. Oh, right here, future trends in nursing. See how easy this is to connect all the dots? Okay. I want to show you I'm going to have to stop sharing for a minute because I want to pull up the study guide for a minute. Study guide. I just want to show you how. Oh, that's not it. RNX. Nope. Where is it? Let's see if I can pull it up. Exam 1 study guide. Okay. Where are you guys? There you are. All right. Each of the topics we just covered in those chapters, this is your study guide. Okay. Each of the what we just covered, there are different sections of the study guide that cover this. Okay, so priority safety assessment. Okay, your key concepts to ADPI safety delegation. Okay, that's one section. Acts and organizations that play a role in public health. I've written on my study guide that these are chapters 1, 2, and 3. Okay, so your acts and organizations, Bernice and Sydney, have you guys figured this out yet? That's what I'm trying to figure out. I think this is 1, 2, and 3. Okay. Management of care across the lifespan. Where's my study guide? Okay. Management. Okay, so yeah, acts and organizations and public health. I have as chapters 1, 2, and 3. Your next section is management of care across the lifespan. I have this as chapter 22. Okay. School nursing, I have chapter 31. School, oh, hang on, management of care. School nursing, chapter 31. Okay, now this is a big section. Family assessments, home visits. Okay, Healthy People 2030. I have this as chapter 20 and 21. Just to help you guys stay organized. Okay. And then next one is vulnerable populations. I'm looking at chapter 23 for that. And your last section is evidence-based practice, which I believe is chapter 9. So I have all your chapters covered. Okay, and it's organized like that in the study guide. Okay, so there's a little section for each chapter. And that's the important concepts and information I want you to take out of that. And this little 5-minute review of the study guide doesn't mean you went to a review. Okay. So when I ask you if you go to a review, oh gosh, did I not share my screen? Oh, you guys.
Yeah, we can see your
You
screen.
can see it.
Oh,
Yeah,
you
we
can see
the
it.
study
Okay,
guide.
all right. All right, so do
Yeah.
you see how this is broken out?
Yes.
Okay, this first part is, there's no chat. This is kind of mixed information about kind of the first 2 weeks. These are a bunch of bullet points. The other thing I'll tell you about is, and I did this in review, as you're going through the study guide, like let's look at the first one. Risk factors for SIDS include, it gives you a whole list of risk factors. So think about, as you go through each bullet, what kind of question might we ask?
Select all that apply.
Okay. Is it okay to select all for all that apply?
Sometimes, yeah. I guess.
You guys know that, right? It's
Yeah.
perfectly okay to select all for all that apply. Okay, perfectly okay. In fact, if you think all that apply, apply. When you're going through questions, maybe read the question and don't look at the answers yet and see if you can come up with your own answer in your head. And then go back and look at the answers and see if you're close. I'm not going through any more of my test taking strategies. You'll have to go to a review session or watch my recording because I want to get onto the Kahoots. Okay. Okay. Oh, there it is. All right. So any questions so far? Is that helpful to go over information like that?
Yes.
Okay. Let's do some Kahoots for the last couple of weeks and see how we do. Okay. I'm going to first do this one. This is for week 2. So I think what I do is I just copy this, right? Copy the, oh my God, what am I trying to say? Copy the URL and put it in the chat, right? So what I do?
There should be a number that we could type in and join.
The PIN number?
I don't have a PIN number. I just have the link. Hang on. Hang on a second. I'm gonna try to, I can't do that. Hang on. Copy. Try that.
Yeah, it pops up.
That work?
Yeah.
But this way, if we play individually, we're not playing it
Text
together.
it.
If that's what you wanted.
What?
The way that you did it, I don't think it allows together. We're gonna need that PIN number in order for us to play together.
Because it's already going on my end.
Well, I see a bunch of your names on here.
I don't know if I'm not seeing your screen, but I don't even see a game pin or anything.
Me either.
All I see is Zoom quit unexpectedly on your screen share.
Yeah, I saw that, but I'm back. Can you guys see the screen that says
I think you're
Kahoot?
frozen.
Okay.
Might be.
Am I still frozen?
Yes, ma'am.
Okay. Okay. Is that am I still frozen or can you hear me now?
We can always hear you. It's just your screen wasn't going.
Is it going now?
You're not sharing your screen anymore.
No, I know, but can you guys hear me and see me?
Yeah.
And
Yeah, we've seen you and heard you this whole time.
Yeah.
okay. So let me try and go back. Can you see that?
Yes.
Yes, ma'am, but we still need a game pin.
I don't have a game pin.
When I logged on the Kahoot, mine has already started doing the Kahoot by itself. Like mine's already like running through all the questions.
Oh,
I think what you have to do is copy and paste the link for yourself there and hit start a new game, and that way I'll be able to generate like a new pin.
How about if I just pull it up on my end, and I just don't want to waste a lot of time on this. I don't, like I said, all I have is the link that I sent you. It's all I have. I don't have somebody can. Let's see. Is there a pin in here? That's the link I have.
Yes, ma'am. And when we click on the link that you sent us, it just takes us to the leaderboard of, I guess, whoever played the Kahoot last. Because I just went and clicked on it.
On this new link? I
Uh,
sent you a new link.
okay, well, let me look at the new link.
Yeah, that's the one that I joined.
The
But like
one-
I said, I'm already like 3 or 4 questions in because it's just timing and running through it by myself.
Do you have your Kahoot account? Because you should be able to save your Kahoots that you've already made and then just click on it as a new game.
Unless you just run it and then we just say it out.
Yeah, I think we just run it because, yeah, I think we just run it. Now I got to figure out how to get it. Can you all see this?
Yeah.
Yes, ma'am.
Red. Yellow. And green.
Just think about what the answer is, and when it ends, we'll say what the answer is.
Oh, oh, okay.
Okay, what do you think? Why is the answer families typically welcome others into their home? So the nurse requests to meet a newly referred family in their home, which best explains the rationale for this request. Does everybody understand why this is the correct answer?
I'm not too sure what it means by a newly referred family in their home.
Yeah, I don't understand the question either.
So, like, the
Alright.
friend is going to go from the hospital to the house?
Like a home health service, or something like that, right?
Pardon me?
Like a home health service? Like a
Uh-huh.
home,
Yep. So, yeah, that's the way I'd interpret it, is it was a transfer from the hospital to home. Okay, so the family typically welcomes others into their home. I think we could probably write that one better. Let's go to the next one. Which of the following factors must be considered before deciding on an appropriate plan of action?
Family agrees to the nurse's plan.
Yes.
Blue.
Blue,
Any other?
family is capable of the required action.
Blue.
Okay. Who said families capable of the required actions? Okay. Why is that the right answer, and why are the other ones not?
Because you have to be capable of it, because even if you agree to it, then that still doesn't mean you're going to do it.
You have to be capable of carrying it out. Right? Okay, we just went through this. Which statements best explains why family functions and structures create unique challenges?
Red.
Yep, red.
Yep. Why is red going to be the right answer?
Because a family that registers as a family as one person might be different for another. Some come from homes, some from traditional.
And they have new family members. They have, yeah, I mean, function and structure change over time. Your roles change Roles change, functions change. Remember, we had those 5 different functions that make up each family. Those are all changing. Those are kind of works in progress all the way through, right? Okay.
I'd say blue.
Blue.
Yeah. Blue.
Anything else?
I was thinking yellow before, but yeah, blue.
Okay, yellow could have been pretty close to a correct answer, but when you're so you need to have an understanding of the different phases of the family nurse relationship. The ending phase is the termination phase. In that phase, and this is on your study guide, which strategies would you mostly likely implement? And you're making referrals, right? Because you're terminating the relationship, so you're providing the family with any additional referrals or services they may need, right? Which of the following theories views the family as a whole with
Blue.
boundaries that are affected by the environment? What?
Blue.
Green. Ooh, no.
Okay, everybody agree with that? Family systems theory?
Blue again.
Yeah, blue.
Right? That's a given. All the others are discussed during the visit, right? Okay, we haven't covered this. This is, so we're gonna skip this. Does anybody know the answer to this question?
It's blue again.
Blue.
Blue.
Okay, so does everybody understands the difference between a genogram, and an ecomap, right? Genograms assist with determining family health risks. So a genogram is like genetics, right? You go back and go through 3, 4, 5 generations of what happened to relatives. Was there a pattern of dying of cancer, heart attacks, whatever? Okay. Whereas ecomaps are the more social interactions with the family in the community. So ecomaps are this, assisting in understanding family relationships. How does the family interact with the community? Do they participate in outside activities? Are they kind of, do they stay at home? They don't have a lot of relationships outside the family. So that's a difference between a genogram and a ecomap. Okay, this is talking about FMLA. This is on your study guide.
Blue.
Yep, blue.
Yep.
Is everything blue?
Yeah, I guess.
Seems like it.
Yep.
Let me push pause.
RN is conducting a health risk appraisal. Which of the following activities is the nurse assessing? Think of your ad pie here. What do you think?
I was thinking either green or blue. One of the two, I'm not sure. Oh, neither one. Unhealthy activities.
Okay,
Okay.
why is unhealthy she's conducting a health risk appraisal.
Mhm.
Okay, so this is a secondary kind of intervention, right? She's doing a screening. All right. And so if she's doing a health risk appraisal, she's going to be looking at kind of the negative, right? What are unhealthy activities? Make sense?
Makes sense.
So again, this is knowing the phases of a home visit. When does she document what's accomplished?
Green.
Yep. And that follows the ad pie, right? Okay, here's our genogram. The RN is drawing a genogram. Which would the nurse use to demonstrate a marriage relationship between two individuals? I don't like this question. Huh?
I said this one I definitely don't know.
No. But we're gonna skip over this. I don't like this question.
Horizontal line. Yeah, well,
Solid horizontal line.
Okay, yeah, I don't like that question. What's this? We don't need that. Okay, which of the following best is, oh, did I lose my volume here? This is in the family assessment chapter. You have to know what a normative life event is. Okay. Does that make sense? I want to do another one here. One more question. I'm going to do two more questions and then I want to go to a different Kahoot. Okay, this is a select all that apply.
Say blue, green, and yellow.
Anybody have any other answers?
no. Well, just kidding.
Well, one of them would be right.
Why is red wrong? Why is that wrong? Because you may not be interviewing every member of the family. You may be interviewing them as a group.
Gotcha.
Okay. All right. I want to, hang on. Bear with me. I wanted to go through. I really want you guys to get a better understanding of primary, secondary, tertiary. Okay. First of all, in your announcements, here's a good Kahoot for evidence-based practice. And then there's your Kahoot for week 1. But there's 2 other ones that are generics that I want to go through. Try and go through. Primary, secondary, tertiary, and AdPi. So if we don't get through them, I do want you to review them. Okay? So I want you, we need to, because for this class, we do need to have a good understanding of these three. Has anybody reviewed these yet? Okay. Define primary prevention.
Where is it? It'd be immunization.
Red.
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 Okay.
Can you speed this up to,
I think if you click it, click the answer, either any answer, it'll go.
oh,
There we go.
oh, Hunter. So smart. Smarty pants. Okay, why is this primary?
Immunization, prevent.
We're trying to
Prevention.
prevent anything from happening at all.
Okay. What is, what's this one? Actions to reduce the occurrence and establishment of a chronic illness. What's that?
Well, they've established they've already got a chronic illness, and so they're trying to reduce the occurrence
Right.
of like issues.
So is that secondary or tertiary?
Tertiary.
Thank
Tertiary.
you. What's this one? Screening to identify diseases in the early stages. What's that?
Secondary.
Thank you. Managing disease post-diagnosis to slow or stop disease progression. What is that?
Tertiary.
Thank you. Why?
They already have it.
They already
Thank
got it.
you. Didn't we just do this? Prevention is better than cure. So it's asking you give an example. I don't understand this question.
I'd say no, that doesn't.
No, that doesn't make sense to me.
I don't understand this question. Delay the onset of disease, reverse its progress, or stop it.
Well, if you reverse its progress, it's already there, isn't it?
It's already there, right?
Yeah.
This level of prevention is a primary prevention. Okay.
The vaccine.
Mhm.
Nursing.
Sorry.
Do we know which one it is?
The vaccine.
The yellow one.
Yeah. There we go. Hepatitis B vaccine.
Okay. And why is this primary?
Because it's preventing.
Preventative to keep you from getting hepatitis B.
Okay.
Again?
That's a whole lot of the same thing.
Would it still be
I would say green.
the still prevention?
Teaching options for preventions.
Yeah, green.
Well,
Okay. What's this one? The desire to change your lifestyle and start smoking.
start smoking?
Should say stop smoking.
So you're already smoking, so that would be your
Tertiary.
secondary. Yeah, well, yeah.
If you're already smoking, you're already,
You
yeah,
already got it.
right.
I didn't know if tertiary would be like you smoking and your smoking caused you to have an issue and then stop, but I get it now.
Where'd she go? Oh, there she is.
Oh, I see her now.
Oh, I think I cut out for a minute here.
Yeah, we can see you, but not your screen anymore.
Okay. Can you see me?
Yeah.
Yeah.
Okay, so it's 1:40, or what time is it? 2:40, right?
Right.
So you guys know the gist of these of these Kahoots, right? You can finish watching week 2 or doing week 2. You have the Kahoot to week 1. You have the rest of the Kahoot to primary, secondary, tertiary, and you have the Kahoot to AdPi. So you have lots of resources. You have the study guide. We went through each chapter briefly, and I gave you my thoughts on your strategies for going through each chapter to minimize the pain of having to read through the chapter from cover to cover. Okay, lots of resources to use in the chapter outline and the keywords to get your answers to the objectives. But everything is built around the study guide and the exam are built around objectives. So if you have a good understanding of the objectives, you're going to have a good understanding of the study guide, and then you're going to be well prepared for the information that's on the exam. Highly encourage you to get to a live review. If you can't, mine's there from this morning. So let's, anybody have any questions? Has this been, I know it's been a lot of information, but has this been a helpful hour and a half? Guys feel overwhelmed? You feel more organized?
I feel more organized after this morning and than our class right now.
You do? Okay. All right, great. Everything's connected in this class. Everything. The lectures are connected to the PowerPoints are connected to the chapter. The study guide's connected to all the chapters. I mean, everything, it's not a whole bunch of different bodies of knowledge. It's all the same, just presented in a little bit of a different way. But you can't avoid the readings. You've got to do the readings to have a basic understanding of how to answer those objectives. Okay, so does anybody have any questions? I'm going to stop and we're going to go to week 2 attestation. So everybody, if you would pull up your week 2 attestation, we'll get that done. If you guys, Julie and Sherelle, if you could turn on your cameras, that'd be great. Let me know when you're at week 2 attestation. Oh, Julie, you're driving, aren't you? Yeah. Okay. So, Julie, why don't you shut off your camera? Because, yeah, just. Okay, what is the first question for? What's the first question for your attestation?
The primary, secondary, and the tertiary.
Okay, we've kind of beat that one up today, right? So if you guys want to just talk out loud about what primary and secondary and tertiary is for all your peers, you can, I said this in the review earlier, and I'll tell you this, primary, I use primary P is for P for prevention. So P and P, primary and prevention. For S, I use S for secondary, S for screening. This is my easy, silly way of remembering it. Tertiary, I do T for tertiary and T for treatment. And then be careful about education. Okay, it came up in the review session this morning when we said what's primary, and somebody said education. Remember, don't get caught up on primary being education, because education is at all 3 levels, right? So education in the primary setting, and I know this isn't part of your answer, but I'm just giving you this information. Education in a primary intervention is about prevention, right? Education in the secondary area, and remember, secondary, screening, early identification, early, identifying those at risk. So let's say you've gone into a high school, you're a school nurse and gone into a high school and done a risk survey of who is at risk for obesity. Okay, well, then your education with that group is going to be how to prevent obesity. So there's education there as well, right? And then there's also education at the tertiary level. Let's say they have diabetes. Let's say they're already obese. Okay, then you're working with them to try and reverse that, or manage it, or come up with a plan. So you're educating at that level too. So don't always think of education only being in the primary, teaching them how to prevent. Education comes at all 3 levels. Okay. So I think it was Sydney, what was it? What is primary, secondary, tertiary, and give an example of each?
Yeah, so primary is prevention. We want to do like vaccines, immunizations. We want to prevent it before it happens.
Yep.
Secondary, we're screening people that are more at risk, identifying what's going on, maybe go ahead and start a treatment. We're educating here too, like x-rays, mammograms,
Mhm.
stuff like that. And then tertiary, we already have it. So treatment is really the option here. Like
Mhm.
is the one-
Management, treatment.
yeah,
Yeah.
like for diabetes, you said
Mhm,
this one.
Okay. Is there a second question, or was the second question give an example of each?
Yeah, that's the
Yes,
next
give
one.
examples.
Okay. So do you guys have that? You guys know
Yes.
what an example would be. Okay. So all in all, I think that you guys should be in pretty good shape or good shape for exam 1. I think, but you got to go back and do the legwork. Okay, so if you haven't done any readings for weeks 1 and 2, you're not going to be able to avoid that. Okay, what I would do if I were you is I would print out the study guide and start from there. What on the study guide do you understand and what do you not understand? What you don't understand, I just went back and went through the study guide and told you what chapters they were. Go back to that chapter and see if what's on the study guide is in that top portion of the chapter outline that you can just click on, and see if in the study guide there's a key word that you can pull up in that chapter under your key terms and go look at it there. And then read that section. Okay. The exam's real straightforward. Okay. And like I said at the beginning, if you have a good understanding of the study guide, the concepts, the knowledge, you can answer the objectives, you are going to do well on the exam. Okay. Questions for me? I know we covered a lot. But I want you guys to be successful. I want us all to go over the finish line together here. Okay, there's no reason not to be successful in this class. None. You just got to put a little bit of time and effort into it. If you're going to blow it off, then you won't pass. And it's not that much. It's just not. Okay. All right. I'm done. I will send the recording when it uploads. Don't forget you have my recording from today's review, and then you'll have 5 more recordings over the next 4 or 5 days. I will stay on for questions. If and when you would like to reach out to me next week after you have done your due diligence of studying for the exam and there's still things you don't get, please reach out to me over the weekend. We'll schedule a time for Monday, Tuesday to review what you don't understand. Okay, I'm happy to spend time with anybody. Okay. Have a good rest of the week and reach out if you need anything, okay?
Thank you.
You're welcome. Bye.
Have a great week.